Are you an athlete over 40 who still feels 25 in your mind, but your joints and muscles don't always agree? What if I told you that with the right approach, you can keep competing, training, and living at your best without relying on surgery or quick fixes? Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge, lower-risk treatments that support longevity and performance. Today, we're diving into one of my favorite topics, how aging athletes can chase the fountain of youth the right way. Whether you're a lifelong runner, a weekend warrior, or someone who just wants to keep up with your kids or grandkids, the truth is, you don't have to give those up as you get older. You just need a smarter game plan. And that's exactly what I'll share with you. How to train, recover, eat, and use regenerative medicine in ways that let you perform and live well for decades. Here's the truth. Aging is inevitable, but decline is not. The difference between athletes who thrive into their 50s, 60s, 70s, and those who struggle is not just genetics, it's strategy. As we age, muscles naturally atrophy and shrink if we do not train them. Joints lose stability if we don't maintain them. Recovery slows if we don't prioritize it. But these changes are not destiny. With the right tools, you can slow them dramatically and sometimes even reverse them. Here's an example. I've seen 70-year-old marathoners who look and move better than some 40-year-olds who gave up training. The difference? Consistent, smart movement, recovery, and managing inflammation and stability. In your 20s, you can push through poor mechanics or nagging pain. In your 40s, 50s, and beyond, that approach leads to breakdown. Training smart means strength training, not necessarily bodybuilding, rather functional strength. Squats, lunges, planks, glutes, and core work to protect joints. Mobility, stretching, yoga, foam rolling. Mobility keeps tissue supple and joints resilient. Balance, critical as we age. Simple single leg drills, Tai Chi or agility work protects against falls. And then there's recovery, the biggest overlooked tool. Focus on sleep, hydration, nutrition, and even mental recovery all matter sometimes as much as your workouts. The analogy is, think of your body as a performance car. In your 20s, you can slam the gas pedal and get away with it. As it ages, you need high quality fuel, regular maintenance, and careful handling. With the right care, that car runs beautifully for decades. Next is nutrition, fuel for longevity. Food is medicine. For athletes, it's also performance fuel. Some key principles. An anti-inflammatory diet is key. More of a Mediterranean style, heavier in vegetables, more fish than red meat, lean proteins, olive oil, nuts, legumes. Limit inflammation triggers. Processed food, sugar, excess alcohol, all the wrong direction. Hydration. Your joints are like sponges. They need fluid to cushion impact. Hydration is key, especially as we get older. Supplements that can also help. Omega-3s, curcumin, glucosamine, sometimes also vitamin D, magnesium, and collagen. Practical tip here, for every pound of body weight that you lose, your knees see about 4 pounds less stress. So a 10-pound weight loss means 40 fewer pounds of pressure with every step. So optimize your nutrition, optimize your weight, and your joints will be able to better handle the stress of your exercise. What about your metabolic health? Metabolism is not just about weight, it's about energy, recovery, and hormones. If your metabolism is sluggish, your performance will be too. So you want to focus on a few key things. Muscle mass. More muscle generally means stronger metabolism. Insulin sensitivity. You want to protect against insulin resistance by limiting sugar and processed foods. Balanced eating schedules. Intermittent fasting can help some athletes, but balance it with your training needs and labs. And protect your metabolism as fiercely as you protect your knees. It's one of the true foundations of longevity long term. Even with great training and diet, injuries and wear can catch up. That's where regenerative medicine steps in. These treatments do not just mask pain, they strengthen and restore tissue. Options include prolotherapy, which is where we utilize dextrose injections to tighten loose ligaments, which is key because instability is what leads to breakdown in the joints and eventually wear and tear arthritis. Platelet-rich plasma, or PRP, utilizing your body's own blood growth factors to repair tendons, ligaments, and cartilage. And then there's bone marrow stem cells for more advanced arthritis or stubborn injuries. So why not steroids? Because steroid injections can eventually break down tissue over time. There's other injections like radiofrequency ablation treatments that you may hear about. They burn nerves, but they weaken stability long term. Again, knowing that stability is a key part of maintaining your joint health long term, you don't want to do treatments that are weakening your stability. Regenerative medicine treatments, on the other hand, build stability instead of breaking it down. Let's discuss some case studies. Case number one, the great-grandmother with knee arthritis. 84-year-old woman with chronic knee pain, have treated her with platelet-rich plasma and prolotherapy roughly every 18 to 24 months. She remains active, her pain is managed, and enjoying her family life. The lesson here is that even advanced arthritis can be managed without surgery in cases. Case number two is the military veteran, 45-year-old, shoulder, elbow, and knee injuries from years of service. He's had multiple PRP and platelet lysate treatments that have helped to restore his function. He's still training and still serving. Case number three, my own father, now 80 years old, a marathoner. Over the last 10 to 15 years, treated him with prolotherapy or PRP for tune-ups for various injuries. We've also done bone marrow stem cells for his knee arthritis when that had become a problem. With that, he's been able to continue to run marathons and stay optimally healthy. Another case, triathlete, mid-50s, hamstring tear. He had bone marrow cells, adipose, and PRP. He's been able to return to full training and continue to stay competitive. Case number five, an older businessman in his mid-70s, severe ankle arthritis and tendon pain. We can't reverse decades of damage, but we can optimize things. A series of PRP treatments have brought him 90% improvement for the last 3 years, and he's doing well. Still lifting weights, still working, still thriving. The lessons here are lifelong athleticism and fully living your life is still possible with the right treatment plan. Let's discuss some myths about aging athletes. Myth number one, aging means stopping. The truth is that aging requires adaptation, but not necessarily quitting. Myth number two, pain is just aging. Again, the truth is that pain is a signal of inflammation, instability, or overuse, and usually those things are treatable. Myth number three, surgery is inevitable. The truth is that most athletes can avoid surgery, even as they age, with smart, non-surgical care. It's always better if you can get that treated earlier rather than later, but even at a later stage, you can still be treated. Myth number four, steroid injections are the only or the best option. Again, the truth is that steroids can break down tissue long-term. Look at your orthobiologic regenerative medicine treatments, things like PRP and prolotherapy, to help strengthen and optimize tissue. Myth number five, it's too late to start. The truth is, it's never too late to help optimize things. I've helped patients in their 80s to restart activity. The key is you take positive, small steps forward, and over time, you can make significant improvements in your life. Myth number six, rest alone heals everything. Rest is key, but the truth is that chronic injuries need stability, which comes from restorative exercises and, if needed, regenerative medicine treatments. One of my favorite mindsets is aiming to be 1% better every day. That might mean 1 extra rep, 5 more minutes of stretching, or just a little better nutrition every day. Over time, those small 1% gains compound into more significant results. In young children, you'll see that they push themselves daily to keep up with what other classmates, friends, or older kids are trying to do. Every few months, you'll see that they've mastered something new. Adults can adopt the same mindset to keep on pushing themselves. We may not beat Father Time, but we can win daily battles by getting just a little better every day. So here's the aging athlete's blueprint to sum it up. Foundation, Daily habits you want to do every day regularly. You want to move every day, even if it's just for 10 to 20 minutes. Strength train 3 times weekly. Mobility work, stretching, staying limber on a daily basis. From a nutrition standpoint, eat to heal. Anti-inflammatory foods. You want to avoid processed, high-carb foods. You want to eat a more plant and vegetable-heavy diet with lean proteins. Stay focused on your hydration. Consider supplements like omega-3s, turmeric, and glucosamine that can be helpful for your joints. Focus on your recovery. Get adequate sleep, 7+ hours a night. Active recovery days means not just resting, it means continuing to stretch, maybe doing some light activity, but still staying active, but still recovering at the same time. And of course, stress management makes a big difference as well in terms of not only your mental health, but your physical health as well. And then there's injury prevention, proper warm-ups, balance and agility work, and of course, don't just train through pain. If you have pain, it's your body's way of saying that's something you need to attend to. And then regenerative medicine treatments, things like prolotherapy for ligament laxity, PRP for moderate tendon and cartilage problems, and bone marrow stem cells for more advanced conditions can also be restorative and help keep you in the game and staying physically active. Then lastly is longevity mindset, the 1% growth rule. Keep on growing a little bit every day. Don't fall back to just accept where you are. Stay connected to a supportive community is always helpful. And keep playing your life. Don't just work out. Try to keep it playful. Try to keep it interesting. And then lastly, monitoring. Get your regular labs from your physician, looking for inflammation. Make sure your vitamin D level is okay. Your metabolic health is optimized. If something is nagging, get it checked out and manage appropriately. Try to live your best life. This blueprint is not about one magic bullet. It's about stacking simple, low-risk habits and layering regenerative medicine tools when needed. That's how you stay active, resilient, and strong for decades. So what's the real fountain of youth for the aging athlete? It's not a pill, a supplement, or a quick surgery. It's a combination of smart training, purposeful recovery, good nutrition, protecting your metabolism, and regenerative medicine when you need it. Aging is inevitable, but suffering is not. Living the best version of your life is an option that you can pursue. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. I'll see you next time, and as always, live well.